Anxiety is a natural human response to stress, danger, or uncertainty. It's a normal emotion we all experience from time to time. But what happens when these feelings of worry and fear become overwhelming and persistent, impacting your daily life? Today, we'll explore anxiety disorders, their symptoms, causes, and the different ways they can be effectively managed and treated. Anxiety disorders are a group of mental health conditions that cause excessive fear and worry. Unlike the temporary anxiety that people feel in stressful situations, such as preparing for a presentation or a job interview, anxiety disorders are long-term and often persist for months or even years. They can interfere significantly with daily activities, relationships, and overall well-being. Let's break down the most common types of anxiety disorders. The first one is generalized anxiety disorder, or GAD. People with GAD experience chronic, excessive worry about various aspects of their lives, including work, health, family, and everyday activities. This anxiety is often disproportionate to the actual situation and is difficult to control. Symptoms of GAD include restlessness, difficulty concentrating, muscle tension, irritability, sleep disturbances, and fatigue. Next is panic disorder. Panic disorder is characterized by sudden, intense episodes of fear, commonly known as panic attacks. These attacks often occur without warning and can include physical symptoms like chest pain, shortness of breath, a rapid heartbeat, dizziness, and a sense of impending doom. Individuals experiencing panic attacks may fear losing control or even dying during these episodes. Social anxiety disorder, or social phobia, is another common type. It involves an intense fear of social situations where one might feel judged, embarrassed, or humiliated. People with social anxiety often avoid social interactions, which can significantly impact their ability to form relationships or perform everyday tasks, like speaking in public. Symptoms include excessive self-consciousness, fear of being watched or judged by others, and physical symptoms like sweating, blushing, or nausea. Specific phobias are another form of anxiety disorder. These involve an irrational, intense fear of specific objects, animals, or situations, such as heights, flying, or spiders. People with phobias go to great lengths to avoid their fear triggers, often experiencing panic attacks, a racing heartbeat, and an overwhelming desire to escape. Obsessive-compulsive disorder, or OCD, is also part of the anxiety disorder spectrum. OCD involves unwanted, repetitive thoughts known as obsessions and compulsive behaviors performed to reduce anxiety. Common compulsions include excessive cleaning, checking, or counting. These behaviors can become time-consuming and interfere with daily life, making it challenging for those affected to function normally. Post-traumatic stress disorder, or PTSD, occurs after a person experiences or witnesses a traumatic event. Symptoms include flashbacks, nightmares, and severe anxiety related to the trauma. PTSD can lead to hypervigilance, emotional numbness, and difficulty sleeping, affecting one's ability to engage in daily activities and social interactions. Now, let's talk about the symptoms of anxiety disorders. While they can vary depending on the type, there are some common symptoms across the board. Emotionally, anxiety disorders cause constant worry or fear, difficulty concentrating, irritability, feelings of dread, and restlessness. Physically, they can result in fatigue, headaches, muscle tension, sweating, trembling, dizziness, nausea, and a rapid or irregular heartbeat. Many people with anxiety disorders also experience sleep disturbances, such as insomnia, which can further affect their daily functioning. These symptoms can become so severe that they lead to avoidance of activities that trigger anxiety, restricting the person's lifestyle. It's important to address these symptoms early on because, as research suggests, the earlier the treatment, the better the outcome in managing anxiety disorders. Ignoring or dismissing symptoms can lead to worsening conditions and greater challenges in everyday life. Now, let's explore how chronic anxiety and a consistently negative mood can affect overall health. Prolonged anxiety can have profound physical impacts, particularly on the endocrine and immune systems. Anxiety can disrupt the normal functioning of the endocrine system, causing hormonal imbalances. For example, it can elevate cortisol levels, the body's primary stress hormone, leading to issues like weight gain, high blood pressure, and changes in blood sugar levels. Over time, these hormonal shifts can increase the risk of developing other health conditions, such as heart disease or diabetes. Furthermore, chronic anxiety can weaken the immune system, making the body more susceptible to infections and illnesses. Elevated stress hormones can reduce the body's ability to fight off pathogens effectively, leaving individuals more vulnerable to colds, flu, and other infections. This is why managing anxiety is not only crucial for mental well-being, but also for maintaining overall physical health. But what causes anxiety disorders? The answer is complex, as anxiety disorders result from a combination of genetic, environmental, and psychological factors. Genetics play a significant role. Individuals with a family history of anxiety or other mental health conditions are more likely to develop an anxiety disorder. Research shows that certain genetic factors can make a person more susceptible to anxiety. Brain chemistry also contributes to anxiety disorders. Imbalances in neurotransmitters, such as serotonin, dopamine, and gamma-aminobutyric acid, GABA, can affect mood and anxiety regulation, leading to heightened anxiety responses. Environmental factors, such as stressful life events, trauma, or ongoing stress, can trigger or exacerbate anxiety disorders. For instance, events like the death of a loved one, financial hardship, or abuse can significantly impact mental health, increasing the likelihood of developing an anxiety disorder. Additionally, certain personality traits, like excessive worrying, perfectionism, or a tendency toward negative thinking, may make some individuals more prone to anxiety. It's also important to note that anxiety can be linked to other medical conditions. Chronic illnesses, such as thyroid problems, heart disease, or chronic pain, can contribute to the development of anxiety. Substance abuse or withdrawal from drugs and alcohol can also trigger or worsen anxiety symptoms. So how can anxiety disorders be treated? Fortunately, anxiety disorders are highly treatable, and several effective treatment options are available. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for anxiety disorders. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their anxiety. By learning coping strategies and ways to reframe their fears, patients can gain better control over their anxiety. Medications can also play a role in managing anxiety disorders. Selective serotonin reuptake inhibitors, SSRIs, benzodiazepines, and beta blockers are commonly prescribed to reduce anxiety symptoms. These medications work by adjusting brain chemistry to alleviate fear and worry, making daily functioning easier. In addition to therapy and medication, lifestyle changes can significantly impact anxiety management. Regular physical activity, a balanced diet, adequate sleep, and reducing caffeine and alcohol intake can help improve mental health. Incorporating mindfulness and relaxation techniques like meditation, deep breathing exercises, and progressive muscle relaxation can also promote relaxation and reduce stress. Support groups offer another valuable resource for those with anxiety disorders. Connecting with others who share similar experiences can provide emotional support and a safe space to discuss struggles and learn coping strategies. If you or someone you know is struggling with anxiety, it's crucial to seek professional help. Persistent anxiety that interferes with daily life, work, or social interactions, or that involves physical symptoms like chest pain or difficulty breathing, warrants consultation with a healthcare provider. Early intervention is key to better outcomes in managing anxiety disorders. In conclusion, anxiety disorders are common but highly treatable mental health conditions. With the right combination of therapy, medication, and lifestyle changes, most individuals can learn to manage their symptoms and lead fulfilling lives. Remember, seeking help is the first step toward recovery. By understanding anxiety disorders, we can better support those affected and encourage a more compassionate approach to mental health. Early intervention, therapy, lifestyle changes, and support. Include a call to action, such as, if you or someone you know is experiencing anxiety, consult a healthcare professional for help.